Hi, my name is Olga. I'm from Nightingale College. I'm going to be showing you the foley insertion of the catheter. I have my badge on, I have my uniform on. So we're going to get started. We're going to walk into the patient's room. Hi, Miss Smith. My name is Olga. I'm going to be your nurse today. I'm going to cover for privacy. Can you please verify your first name and your date of birth, please? All right, thank you so much. So today your doctor has ordered you a foley catheterization insertion. So I'm going to be helping you with that today, and I'm going to be walking you through all the steps. This is going to help you urinate and go to the bathroom better, so it would prevent you from being in pain. So I'm going to start off. Let me know if you have any questions. I'm going to sanitize my hands. And I have all my supplies here, my trash bag, my clean gloves, my towels, and my kit. So first I'm going to start off putting on my clean gloves. Alright, so I have my clean gloves on. So I'm going to start washing your labial area. So we're going to start that. We're going to dip this in water and soap. We're going to start from the outside, front to back, and then we're going to switch spots. We're going to start from the one that's closer to me, front to back, and we're going to do the middle, front to back. We're going to dispose this, and now I'm going to pat you dry so that we don't have anything there. All right, front to back, and then I'm going to do the middle, front to back. Okay, Miss Smith, so now that I'm gonna do all the next steps, I'm gonna grab your labia here. I'm just gonna observe and see if there's any complications, no suspicious things. You are good to go. Perfect. So I'm gonna take off my clean gloves, and I'm going to sanitize my hands. Okay, Miss Smith, we're going to set you up for your procedure here. So I have my kit here. I'm going to open this up, dispose of this back, and then I'm going to dispose this. Okay, so I'm going to be very careful. I'm just going to touch the corners. Move it over a little bit. This one. And now I'm going to don my gloves. I'm going to dispose, take this out. Move this to the side. Just going to touch the borders and then just switch this out. I'm going to wash my hands since I touched that. Going around. Alright, I got down my gloves on. I'm going to do this and dispose. Okay, so now Miss Smith, I'm gonna start setting you up here. So I'm gonna have you in a supine, laying down. I'm gonna bring down the bed. I'm gonna have you spread your knees upwards, and we are gonna get started. So first I'm going to drape you. So I'm gonna have you bring up your hips, and I'm gonna put your drape, the shiny side down. Patient is draped. Perfect. And then the next, I'm going to put a drape over you. Perfect. Now I'm going to set up for the procedure. So I'm going to open up my alcohol wipes. I'm going to put it in my tray here. Discard this, and I'm going to open my lubricant. I'm gonna put some in, discard that, and I will open this section. Discard that. I'm going to place this in the lubricant just to get ready. Next, I'm going to take my syringe and I'm going to open the cap up. I'm going to discard this and I will put it inside this area. Make sure that's secure. Next, Miss Smith, I'm going to get started on your procedure. So you're going to feel my hands right now. I'm going to spread your labia. So I'm going to start off of cleaning your area up again. You're going to feel a little cold, okay? So I'm going to start from front to back, around here, and then front to back, closer to me. And then front to back in the middle. All right, Miss Jones. So now we're going to start with the insertion. So make sure that it's inserted with the lubricant. So Miss Smith, I'm gonna have to do this. So you're gonna feel a little pinch of my hand, and you're gonna feel this. So let me know if you have any pain as we insert it. So I'm gonna get 2 inches in. Okay, now we're seeing urine flowing out and we're gonna go 2 more inches in. Okay, now that we have 2 inches in, okay, Miss Smith, you're gonna feel a little pressure. So I'm going to make sure that I push in the 10 milliliters. All right, so you're gonna feel some wetness in there. All right, I'm gonna make sure that I push in all of that in. Okay, all right, how are you feeling? So what I'm gonna do, I'm going to release that. I'm gonna discard. And then I'm gonna make sure that this is not on my way. Now I'm going to take this out. Make sure that I'm holding it. And I'm going to put this on the side of the patient. And before I do that, I'm going to make sure that I put my fold on her, the sticker around her hip. So Miss Smith, I'm just gonna adjust to make sure that this is good for you. And then that's good, it's on her. Are you feeling comfortable? Yes, okay. Perfect. So now I'm going to put this around the patient's, not on the moving portion of the rail, but the non-movable on the bed. Okay, now this is inserted. Okay, Miss Smith, how are you feeling? You feeling good? Okay, so now I'm going to clean up. It's not sterile anymore. Off. That area. The scar. Gloves off. All right, Miss Smith, how are you feeling? You're feeling good? Let me know if you need to use the bathroom. We just want to make sure that you're comfortable and everything is staying in place. So you are all set. Let me know if you have any questions. I'm going to go back and I'm going to document, and looks like you're doing good. All right, thank you.